to the extent that our care court has been successful, it's because of the collaboration and relationship that the court has developed with behavioral health, with the public defender's office, and with BACS. We have really worked together well, and we started early on when we knew that we were going to have to stand up this department. We started working in April of 2023, and behavioral health hired a consultant to help us coordinate ourselves. When you think about having the court with a lot of egos and a big agency like behavioral health, it was really important to have somebody independent who would coordinate us and help us along the way to learn to work together. And I believe that we have learned to work together really well, and it's been a pleasure for the court to be able to work with an agency. Courts don't typically do collaboration, so this has been very different for us. I was fortunate to be the person who was asked to do the care court because I was the only one who wanted to do it. The other person who was interested retired, so I was delighted. I really felt a need for this program in Alameda County. I've lived in Alameda County since 1977, before most of you were born, and it's heartbreaking to drive around the community, to go to the courthouse where I work, and see the people who are living in just horrific conditions. And this CARE Act court really serves the most vulnerable people, the people with mental illnesses. But what I learned early on is that it's not just the mental illness, it's also substance abuse and also developmental disabilities. So these are folks in the community who really can't take care of themselves on their own. And it's very important for us to get out in the community and try to do everything we can to assist these folks. I was asked to talk about a couple of cases that would be our successes. We've had a number of people who have done really, really well. And what comes to mind is someone on the high end of the spectrum and someone on the low end of the spectrum in terms of intellectual ability. We have a woman who is developmentally disabled. She had substance abuse problem and also a significant mental illness. She now has her own apartment. She's taking medication, and she's doing extremely well. We have people with advanced degrees who are also in the CARE Act court, and somewhat similar to the person that I just described, we have a person who was a debate champion before his mental illness, and then at one point in time developed mental illness, became homeless. His petition was brought by his family, and he's doing very well. He has his own apartment now. So the housing component for our CARE Act participants is critical. It's one of the most important things that we can give them. I had a person who was in court not too long ago who was telling me about how he was living on the street and he had to protect his belongings at all times, that he was being assaulted, that he would have his possessions stolen, and he was just so grateful to have a place to live.